The role of National Households Registry data in providing social protection is what we are just about to discuss. An acting national coordinator, I beg your pardon, of the Ghana National GNHR, that's responsible to eradicate poverty remains key on government's agenda. The coordination, effective implementation, and sustainability of various social intervention tools aimed at addressing the problem, however, remains a challenge to the Ministry of Gender, Children and Social Protection. As part of its Social Protection Dialogue series, the Ministry will discuss how the Ghana National Households Registry data could be used effectively in targeting the extremely poor households in providing social support in Ghana. Acting National Coordinator of the National Household Registry, Dr. Prosper Larry, joins me in the studio for a conversation on the subject. Good morning, sir. Many thanks for your time.
Yes, good morning.
First of what is contained in the National Household Registry data?
Yeah, the Ghana National Household Registry data. We have information on household information and household members, categorizing them into poor, non-poor, and extreme poor, so that from that data we can draw beneficiaries of social intervention programs.
And how useful is this data in dealing with poverty? Because we have statistics, we have a Ghana Statistical Service, we have statistics that we're even using for the LEAP program. So really, what is all this about and how effective is it in dealing with poverty?
Yeah, thank you. One of the reasons for the Ghana National Household Registry was to prevent this kind of duplication we are talking about. We have had so many social intervention programs like the LEAP, as you rightly mentioned, capitation grant, distribution of free school uniform. But one of the things that we've not been able to do is to disaggregate data, that is try to get data of household members. And so Ghana National Household Registry was established by the Ministry of Gender so that we can go close up to various households, and then these households are enumerated so that we can get the specific targeting units that we are looking for. You know, Ghana Statistical Service, they have their data, and in fact, GNHR works closely with them because we use what we call the proxy mean test. And the proxy mean test, we use verifiable indicators like various households, the household structure, household composition, durable assets, and some of the other indicators that we can see. And through this, like in Upper West, we've already concluded our data in Upper West, meaning that LEAP will not need to do any household survey again. And any other social intervention that is going to be done will have to draw its data from GNHR. So yes, we use most of the tools that GSS will use because our PMT is designed based on GSS. But this one, we directly do a census of various households so that we can get up close to each individual household.
So apart from the Upper West region, like you mentioned, which other regions have you been to?
In fact, we are concluding the registry for the Upper East region. So far, we've been able to enumerate about 184,593 households. And we are thinking that by the efforts of the Honorable Minister of Gender, Children and Social Protection, we are scaling it up to the other 8 regions so that we can have that unified data. That's why we said single registry. We need as a country a single registry in which we can draw all our data for social protection. So completing Upper West and Upper East is not enough. I mean, when we go through the entire country, it means we'll have a useful resource to draw our social protection intervention programs.
Help us understand how you do this registration. So do you go into communities just looking out for maybe poor homes to include in the register? Or you do a general survey and then catalog the poor homes? Just want to understand how the work is done on the field.
Yeah, we use a census approach.
Okay.
And a census approach means that just like it's done by Ghana Statistical Service, every household, every community, and every house is eligible to be enumerated. So when you take that of Upper West and Upper East, we have moved up close to about 90 to 95% of the entire population. However, it's not compulsory, but we do a lot of public information campaign. It's not enough just to have a register for the poor. because we have other data that we pick from it, which is also very important for the socio-economic development of various planning units. So it means that every household that avails itself is enumerated in this process. We don't just move to. So we do a whole clustering, we do a whole enumeration area, and it's a total exercise of capturing every household that avails itself.
So if I live at Ringway Estates in Accra, should I expect you in my home soon?
Yes, you know, when we come to Accra, we will do something like a mixed approach of census and mobile registration targeting center.
Okay.
Because as you move to urbanized areas, the rate of poverty decreases. And also enumerating every household is pretty much expensive. In the 3 northern regions, whereby statistics, poverty is more endemic in those areas, like northern region, upper east and upper west, we decided to use a census approach so that you can capture every other extremities of the poverty situation. But you see, like you rightly asked, when we move up to the urbanized areas like East Legon, you move to some of those areas, there are still pockets of poverty within those areas. But maybe because of the cost, you will not be looking at doing a total census, but you'll be looking at getting targeting centers in which maybe the poor and those that live in those pockets of those places, you can easily identify them and you can enumerate them so that we prevent this kind of exclusion. Because the main reason of these programs is to ensure that those who are really needed as far as beneficiaries of social protection interventions are concerned are well targeted. So you don't want to exclude anybody in any way.
So who eventually is going to be using this data that you're collecting? I mean, institutions, and basically what for?
The main reason for GNHR was to design this data so that social protection interventions like LEAP, LIPW, capitation grant can draw from that data in selecting their beneficiaries. But one of the added capability of this data is that we're able to pick situations of sanitation, lighting conditions, water, and planning for those assemblies that need this data becomes very critical. We just ended a dissemination workshop in Upper West, and the various planning authorities decided that most of the indicators that we have will be useful for them to use for their annual budget review and planning. Meaning beyond social protection, we have the MMDAs. We have had interaction with Well Food Program and CDD. And you know, they normally do this sanitation ranking, and they've realized that this data will also be useful for them. We are able to keep stock of livestock and other durables. In fact, very useful information. That is why we are doing this dialogue, because we see that the GNHR has a lot of rich information, rich data that is needed. You will get to realize that the number of ownership of mobile phones in Upper West, when we completed the data exercise, we realized that mobile phone usage and the number is even more than television. So that's interesting.
Very interesting. Now, so have you already started using this data? Have people started benefiting?
You know, we just completed the exercise. And so for that respect, LEAP is doing an expansion program. And having validated this data by GSS, expansion in Upper West and then Upper East, we will draw from this data moving forward. They will no need to do any kind of enumeration again. As I said, the assemblies are already using this data for their planning, but we want to make it very available because we have a data sharing protocol. We also had interaction with academia, because once we have demographic characteristics, education, health, and other indicators that are relevant for research, then it means that this data cannot just be seated there. I mean, people will have to use it, give feedback, and make it usable.
So are you saying that the GNHR is going to make it possible for us to identify people who take advantage of the system to benefit from more than one social intervention? The GNHR is going to make it possible for us to identify those people and be able to have a more transparent...
Yes, in fact, that's the reason. So when we take the data, we do an electronic data enumeration process, and we take biometric information of the 10 fingers. Meaning that when you link it up, you are able to take out, we do what we call a deduplication process. Through that, you're able to identify a member that have registered even more than once. And we have also gone into some collaboration, and we are in discussion with the National Identification Authority. You know, of course, they are the sole body responsible for this biometric information, such that if the whole country goes biometric with this kind of information, we'll be able to prevent fraud. Because you really want to be sure that those who need social interventions are well targeted. So you are not able to give up to the number you are looking out for. So you wouldn't be watching out for people that would duplicate. Our system is electronic and biometric. and able to take out all these duplicates.
So tell us more about the National Social Protection Dialogue Series, because the theme that the program is running with is the role of the GNHR in achieving sustainable development goals. Tell us more about the dialogue, when it's going to happen, and what you hope to achieve.
The dialogue will be tomorrow at the Fiesta Royal Hotel. We are inviting key stakeholders like UNICEF, like the World Bank, like the National Development Population Council, and the MMDAs, the academia, civil society organization. We want to let them know the Upper West data and the Upper East, just this kind of interesting discussion that we are talking about, so that through this dialogue, we also want to have a feedback, having presented the situation, the kind of suggestions that we can have to improve this data. So tomorrow, basically, we will be having this kind of rich experience. And we have tied it to sustainable development goals, because, you know, one of the critical areas of the SDG, that's especially goal 1, is to reduce poverty of all its forms everywhere. And you will realize that Ghana has made significant gains. Right from 1991 to 2013, we've been able to have poverty. But you see that those that are extreme poor, that forms about 2.3% of what we are looking out for. You ask yourself, where can you find them? Where are they? And who are those kind of people? That's why research is important, for a scientific quantification of this kind of ideals. And let's not forget that our president is also the co-chair of the SDG, meaning that we should be working very hard at really getting the scientific information and addressing it head on. So we're thinking that data is the first point of call.
Dr. Larry, how are we funding this, and how often do we hope to go back onto the field to get more data?
This is a World Bank funded project, and it ends May 31st. But
May 31st, 2018?
Yes, 2018, because the first phase of it was supposed to take Northern Region, Upper East, and then Upper West. But we've had discussions. The Honorable Minister of Gender, Children and Social Protection, Honorable Otiko Afisa-Jaba, has been very passionate about this. We've had a series of meetings in Washington concerning this, and we are very close on rolling the second phase, which I talked about, covering the entire country.
Which is also funded by the World Bank.
By World Bank, but we're also looking at other arrangements, because, you know, update of data is very expensive, because you are doing a census approach, and it's an MIS electronic system, very expensive. And we have always said that update of this data is very important. Maybe for every 4 or 5 years, you need to update that. Ask yourself how long we take to even take census. I mean, 10 years. But we have tied GNHR to the Ghana Living Standard Survey, GLSS, which is being updated every 4 or 5 years, which is pretty much easier to do. But for maybe people of social intervention program, we do what we call recertification. Okay. Through that, we are able to tell poverty is dynamic. And so people move up the bracket, and others also come down. So you need to recertify as time goes on. So we will try as much as possible, but as you can see, it takes a great deal of money to update the entire data.
Interesting. So in subsequent years, we need to find a way to fund it. Is that it?
Yes.
Well, thank you very much for your time, Dr. Prosper Larry. He is acting national coordinator of the Ghana National Households Registry data. We've been talking about how that data helps in providing social protection ahead of the 4th Social Protection Dialogue Series tomorrow. We'll take a quick breather, and when we come back, we'll bring you business news.